Hello lovers of moments, Esther Uche every Sundays. You are all welcome to my program. Today we are celebrating International Father's Day and your favorite girl Esther Uche is wishing you all happy Father's Day. May God bless you, keep you safe, God will replenish your pockets, especially to my daddy. Okay, now you are all highly welcome to my program, Moments with Esther Uche, every Sunday's episode 13. I still remain your girl, Esther Uche. Back to my favorite topics on health, environment. Now, I'm so glad that I'm on health today. Today I'm going to talk about diabetes, the cause of diabetes, and how we can control the disease. Now, some people have heard or had diabetes, but they don't know what it is. I'll start with the definition. Diabetes is a condition in which the body does not properly process food for the use as energy. Some food that we eat are turned into sugar or glucose for the use as energy. Now, the main cause of diabetes is a chronic condition associated with the abnormally high levels of sugar, which is also known as glucose in the blood. Absence or insufficient production of insulin or inability of the body to properly use insulin causes diabetes. Now, some people ask, does sugar cause diabetes? Since diabetes is a disease characterized by the high blood sugar levels, but we all need to understand that body differs. Yes, body differs. Like I defined diabetes before. It occurs when the body is no longer able to produce insulin, and this is when the pancreas stops producing enough insulin. Now, you might be thinking, what is the pancreas? Pancreas is an organ located in the abdomen. It plays an essential role in converting the food that we eat into fuel for the body cells. You may also think, what is insulin too? Insulin is considered the main anabolic hormone of the body. It regulates the metabolism of carbohydrates. So in that case, we don't need to consume a large amount of sugar to lower the risk of diabetes. Remember, sugar, which is carbohydrate, is the first energy source the body goes to. It is more faster to break down into energy than protein and fat counterparts. Now let's look at the diagnosis. Diabetes diagnosed with the fasting sugar blood test or the A1C blood tests, also known as the glycated hemoglobin test. A fasting sugar test can be done when one has had nothing to eat for at least 8 hours. A normal fasting sugar test is less than 100 milligrams per deciliter or 5.6 millimoles per liter. There are a lot of diabetes out there that one can develop when diagnosed with diabetes, which I don't want to mention, according to fears and anxiety. The good thing is that it can be controlled. Yes, it can be controlled. And to tell you, there's almost no cure for diabetes. It can go into remission. Now, people can manage the disease with medications and lifestyle changes. Testing can also help to find pre-diabetes. Making lifestyle changes to lose a modest amount of weight if you are overweight, and may also help to delay or prevent type 2 diabetes. Now, there are two types of diabetes, type 1 diabetes and type 2 diabetes. There is also gestational diabetes, which is for pregnant women. All pregnant women who don't have a period diabetes diagnosed should be tested for gestational diabetes between 24 and 28 weeks. Gestational diabetes occurs only during pregnancy, and gestational diabetes can cause health problems for both mother and child. Managing and preventing it can help protect you and your baby. Now let's look at type 2 diabetes. Yes, type 2 diabetes is a lifelong disease that keeps one's body from using insulin the way it should. People who have type 2 diabetes are said to have insulin resistance. People who are middle-aged or older are mostly likely to have this kind of diabetes. So it used to be called adult onset diabetes. But type 2 diabetes affects children and teenagers, mainly because of childhood obesity. Now, these are some symptoms of type 2 diabetes. 1. Being very thirsty, being vision, fatigue worn out, wounds that don't heal, hunger, weight loss without trying, and getting more infection. These are some symptoms of type 2 diabetes. Now let's see type 1 diabetes, used to be known as juvenile diabetes or insulin dependent diabetes. Is a chronic condition in which the pancreas, which I explained before, produces little or no insulin. Insulin is a hormone needed to allow sugar into the body cells to produce energy. Now, different factors, even genetics and some other viruses, may contribute in type 1 diabetes. Now, type 1 diabetes, although type 1 diabetes develops during childhood or adolescence, it can also develop in adults too. Now, these are some symptoms of type 1 diabetes. Increased thirst. That is one. Increased thirst, frequent urination, bedwetting in some children who don't bedwet in the night. Like your children start bedwetting in the night when you know they don't normally wet the bed in the night. So when you see that kind of thing in your children, you should just remember that I said that when that thing happens, that means your child has developed type 1 diabetes. Another one is irritability and other mood changes. Every time your child gets irritated and her mood starts changes. Another one is unintended weight loss. When your child or you is losing weight and you don't want to lose weight, you're not doing anything, you're not exercising at all, and you start losing weight, just know that you are developing type 1 diabetes. Another one is blurred vision. You won't be seeing too well again. Fatigue and weakness. So you start feeling weak. If they tell you to do something, you'll be like, I'm weak, I can't do this. And the thing is that the cause of type 1 diabetes is unknown. But it's usually the body's own immune system, which normally fights harmful and strong bacteria and viruses. Now, mistakenly destroys insulin producing cells in pancreas. Now, this is when possible cause occurs. I will stop here so far, but before I do so, I would like to discuss on the way we can follow this so-called disease, diabetes. I believe myself that the best way to control this disease is by lower blood sugar, the way you take sugar naturally. Now the question is, how do I do that? Because you be like, how should I do it? I don't know. Here, these are some examples on how you can do it. Exercise regularly. Early morning exercise can help lose weight and increase insulin sensitivity. Control your carb intake. Don't take too much things with carbohydrate like yam, rice and other things. Increase fiber intake. Drink water and stay hydrated. Do you know how many times my mom drinks water? She drinks water every single time, and that is very good. When you drink water very well, you will see you'll be healthy. You'll be healthy and you stay hydrated. Another one is implement your portion intake. You know the way you take food. Don't take too much food. Don't take much. Like me, I don't eat much food. When my mommy or my auntie makes a big something gives me big food, I'll be like, please cut this food for me, or someone should come and take, sorry for that noise, someone should come and take small from my food. So when you take too much, it's not actually good for your health. Choose food with low glycemic index. You might be thinking, what do I mean by glycemic index? What I meant by glycemic index is a relative of carbohydrates in the blood according to the way they affect the glucose in your blood. Another way is control stress levels. Don't stress yourself too much. Like in one of my episodes, I talked about that. Stress management is also the same thing as control stress level. Monitor your blood sugar levels. Always go to the hospital to check your sugar level, if it's high or low. If it's high, you need to stop taking food with sugar. Like my mom now, the last time she went to the hospital, her sugar level was high. So now when we want to take rice, she takes another thing. It's either she takes plantain, which is iron with vegetable, or if she wants to eat rice, she takes rice and puts a lot of vegetable into rice and lot of vegetables. That is the way you can control your sugar levels. And she doesn't drink tea again or eat bread. If she wants to drink tea, she doesn't drink pap, she drinks oil. If she wants to drink any of those two, she fries egg. You know, when you fry egg, that is what my mommy does. So all those things are good. So my viewers, this is the end of today's topic. We all know that sickness and problems do come sometimes. Yes, when you are like this, your problems will come, sickness comes. But I pray that and I believe in God that no sickness that is greater than us will come to us. For he that is in us, my viewers, I'm referring to you, myself, my family, and every other person out there, is greater than every other sickness or problem. So this is the end of today's show. Don't forget to subscribe, like, view, and share all my videos. You can always watch me on YouTube as Moments with Esther Uche every Sunday. Thank you all for viewing. Thank you all for subscribing. May God bless you, and thank you all for liking. You can, and always, please don't forget, I repeat it every Sunday, and I will not stop repeating it. Wash your hands and sanitize your hands. Wash your hands with running soap and water. Wash it with good water. When you notice that your running tap water is no good, you need to look for a way you can get a clean water and wash your hand with a good soap. Wash it for at least 20 seconds. And sanitize your hands with hand sanitizer that is better than 60% alcoholic content. Now, wear your face mask. I'll use myself as an example. When I go out, I always wear my face mask. If it's me and my mommy, we always wear our face masks when we are going out. But sometimes you also need to wear gloves, so that whatever we touch will not contact it. But the best thing, some people don't like wearing gloves, but they think that maybe they combat they will wash their hands. So please, when you come back from where you are going out, don't touch anybody, because you don't know who you have touched, you don't know what you have touched. Wash your hands and sanitize your hands. God bless you all. I love you all. Stay safe and stay tuned for my next interesting episode. Goodbye.